Genetic testing of embryo is technically referred to as pre-implantation genetic screening or diagnosis. We observe over the age that the common causes or the common cause of failure of an IVF treatment cycle is aneuploidy, which is abnormalities that is seen in the embryos and usually may be associated with the eggs or even with the sperms. And over 98% of the causes of failure of an IVF treatment cycle is related to the level of abnormalities inherent in the eggs or the sperm or even the embryos. As a result of this, you may begin to wonder whether or not the embryos need to be tested before embryo transfer is made. Genetic testing or pre-implantation genetic diagnosis is, however, very expensive and is not a commonplace even in the practice of assisted reproduction technology, as many centers have not started conducting genetic testing or even don't have the facility for genetic testing of embryo before transfer. However, there are conditions that I deem pertinent requiring genetic testing. Situation where you don't want a disease condition to be transferred to an offspring, deadly disease conditions, genetic testings would be necessary. I also would suggest that since failure rate and the rate of abnormalities of embryos are higher at advanced maternal age, at those ages, genetic testing of the embryos would be necessary. This would, however, require a huge sum of fund or government assistance or even insurance to carry out these processes. At the moment, genetics testing worldwide is done to eradicate embryos that have tendency of transmitting disease condition to an offspring. So I will advise that genetic testing is done to eradicate disease condition, and also that genetic testings should be done when the embryo is on day 5. That's a blastocyst biopsy taking. So genetic testing will guarantee lesser number of embryo transfer, precision in selection of embryos, and will also eradicate disease condition where it is done. So I think genetic testing is a welcome development in the field of IVF or assisted reproduction technology. For more of this information, you could visit our site, or better still, visit our facilities. Until I come your way next time, I'm Dr. Kenneth Eguda, a consultant gynecologist and IVF specialist. Thank you for viewing.